Alzheimer's disease, like other dementias, but especially Alzheimer's disease because of its prevalence, is the epidemic of the century. It affects the patient by robbing them of their cognitive abilities. It affects their families. And it's also a mystery in many ways, even though scientists and investigators are trying to peel away and understand the underpinnings of this mystery. It's a mystery because it's a common disease, but it's also very, very complex. And ultimately, the approach is to be able to find precision medicine biomarkers that will enable us to predict whether somebody is going to develop Alzheimer's disease, how fast that their disease may progress, and eventually to be able to find precision medicine cures for this very complex condition. We know that Alzheimer's disease afflicts patients from African American backgrounds at a rate twice as high as that in white populations. For Latino Americans, the risk is 1.5 times greater than that in white populations. And yet, African American and Latino American populations have, until relatively recently, been understudied for Alzheimer's disease. We aim to understand the link between the fingerprints of the disease in the brain, which is our central control unit, if you will, and we try to then link these fingerprints in the brain to those in blood. Why? Because we need to be able to identify the disease, follow its fingerprints in an accessible organ. We will have access to biospecimens, and by that I mean brain tissue and blood specimens from patients who are participants in the Mayo Clinic study of aging, who are participants in the Alzheimer's Disease Neuroimaging Initiative, as well as those who are partaking in Alzheimer's disease research center studies at 6 different centers across the United States. So by arming ourselves and the research community with a vast amount of data and knowledge that will be generated from this program, and by joining forces, knowledge, by putting our heads together, the hope and the goal and the expectation is that we will accelerate the discoveries to put an end to this devastating disease.